We're probably gonna wait until. That's just in case you have to like look down. Yeah. Good. Awesome. All my people are here except my supervisor, but she's on her way up. Oh, yeah. Okay, so should we wait till 10? Yeah, but they have those. Yeah, exactly. That didn't turn out all right. Yeah. Right. So I was like, and I told Dave about those things because. Right. Yeah. I was like, but still, it's an internship, so they don't have to give you jobs. They also need to. So. When he has it, we have to go over down here, and he's still going through surgery. Like, no, my parents. I don't have any family, and I don't think I could do it. Yeah. That's what they said. That's what they said. One person. Just a lot of organizing stuff. Yeah. You made the first. No, that's people. I think that's what that's why I think unless it's really yeah, because everywhere else is like 2 hours. I also I was a little worried. Yeah. Yes, I'm so excited. I texted my cohort to come over.
We all should have done an announcement for practical instead of us here today.
Oh, they're out of fire. Oh, I've been out for about. He's like, we're gonna take it. Oh my God. So weird. Well, something like that. I'm watching. Yes. Right.
Oh, yeah.
The firefighters that Let me ask. Yes, of course. They have Grace Academy. They have Grace Academy. Yeah. I don't know if I really need a mic, but I'll use it anyway. Make my voice a little bit. So thank you for coming today. We are the Ringers of Hope from Dignity Health Hospital. All these individuals are stroke survivors, and they all have interesting stories, and they will be sharing that with me today. I am Emmy. I went to ASU. I graduated 2020. I'm a neurologic music therapist. And once a week, I get to hang out with these cool individuals, and we make some music with the chimes, and we sing. And I've been with them since January, but they were actually one of my practicum classes when I was in college. So when the old music therapist was like, I've got a family, I can't do this anymore, she decided to call me up and said, hey, you did awesome in your practicum. Do you want to try this out? And so my advice to you is do really good in your practicums. Okay, so we have 6 songs for you today, and then we're gonna have the stroke survivors, some of the stroke survivors share their story about the progress they made since their stroke and what's gone into that. And after that, we will have Yuli, my supervisor, talk about stroke prevention and awareness. Right? Cool. And then if you guys have any questions for me with music therapy or the stroke survivors or Yuli or even the caregivers that are sitting right up here that have also been a part of our journey, more than welcome. We were good, we were old, kind of dream, and we were right, till we were the home and watching her. Oh, I didn't want to leave you. I didn't want to write. Started to cry. Remember, I can find myself flowers. Write my name in the sand. Myself for hours. They think you don't understand. I can take myself dancing. My own hand. Yeah, I can love me better. I can love you better, babe. Can love you better. I can love you better, babe. Paint my nails cherry red. Passion roses that you love. No remorse, no regret. I forget every oh, I didn't want to leave you. I didn't want to started to cry. And remember, write my name in the sand. Talk to myself for hours. Say things you don't understand. I can take myself dancing. Hold my own hand. Yeah, I can love me better than you. I can love you better, babe. Can love you better. I can love you better, babe. Can love you better. I can love you better, babe. Can love you better. So. So I decided to choose one that's on the radio all the time, and a little bit with empowerment themes. So next we'll be singing Brown Eyed Girl with chimes. Hey, where did you go? Days when the rain came down in the hollow, playing a new game. Laughing and running, skipping and jumping in the misty morning. Our hearts jumping again. Brown-eyed girl. Brown-eyed girl. Whatever happened, Tuesday is so slow. Going down here on my rhythm. Transistor radio. Standing in the sun like that. Hiding behind the rainbow's wall. Sipping outside. Brown-eyed girl. Now that I'm on my own, say just the other how you cast my memory back and forth. Sometimes I'm thinking love is a dream grass. I can help what's on the floor, but next we'll be performing Stand By Me. Just as long as you stay away. So in the sky that we want should crumble and fall. All the mountains should crumble to the sea. I won't cry, I won't cry, no, I won't shed a tear. Just as long as you stand by me, and stand by me, oh, stand by me, oh, stand by me, stand by me, got a favorite next. It's a favorite of mine. Country Roads by John Denver. West Virginia, Blue Ridge Mountains, Shenandoah River, like the older than trees, stronger than mountains, moving like waves. Country road, take me home to the place I belong. West Virginia, country road, take me home. Country road, all my memories West Virginia, down to home, take me home, country road. I hear her voice in the morning as she calls me. The radio reminds me of her home far away. Driving down the road, I get a feeling I should have been home yesterday. Country road, take me home. On and on, West Virginia, mountain bound, take me home. Country road, take me home to the place I know. West Virginia, mountain bound, take me home. Country road. Next, we'll be doing Let It Be, and this is our second to last song before our closer song. There will be an answer. Let it be. Though they may be parted, there is still a chance they will see. There will be an answer. Let it be. Let it be. Let it be. There will be an answer. Let it be. And when the night is cloudy, there is still shine until tomorrow. Let it be. I wake up to the sound of music on the merry speaking words of wisdom. Let it be. Let it be. Let it be. Let it be. There will be an answer. Let it be. Let it be. Let it be. Let it be. There will be an answer. Let it be. This song is, near and dear to their hearts. We end with it every session. They've ended with it almost every session before me, right? So they sing this to say goodbye. So I decided to make them chime in this year. And it's called Happy Trails. The 6 songs that we chose throughout all the songs we did these past couple months. They worked really hard. We meet once a week on Thursdays at Dignity Health, and it's always a good time. But now, more importantly, we're going to be talking about the stroke survivors experience. A couple of them have volunteered to share their stories. So they'll introduce themselves and kind of just have you get to know them.
My name is Dave Verbock. Wife and I have lived in Mesa, Arizona for 14 years. And 3 years ago, we moved to Salem, Oregon. And we have been part of this organization for about 10 years. My stroke was 14 years ago. And I was blessed in not having paralysis. Mine was primarily speech loss. My brain was injured on the left side of the head. I had a lot of speech therapy, OT, PT, all of it. And this organization, Dignity, is something that we have never seen before. We have people that are dedicated to making our lives better. We get so much inspiration from people that listen to us, that try to understand us. And this is an incredible experience for me. I've never seen so many people in one place that are interested in speech therapy. I salute you. I hope you can find an organization that will allow you to use these tools as well as speech. My downside is aphasia, and you may have watched that I don't read the words and sing the songs because I can't. If I know the songs, I can sing them, but I can't do 2 things at one time, apparently. So that's where I'm from, and I salute you for taking on. There it is. You see it? That was my favorite, because that word would not come out. Sometimes I try to tell a story about the word. This morning, I don't have that either. I'm blessed to be part of Dignity Health, and we will be for the rest of our lives. And me, and all my friends, and my family. Like, you cannot imagine how important this is. Thank you.
We didn't talk today. This is really good. So, we're not, we're stroke survivors, not the always kind of chorus, but we did.
Yeah, you did amazing.
I had a stroke in 2016. And I've been going to Dignity for all the time I've been there. They didn't have a rehab, but so I was retired and I had to kind of do what I needed to do, and I go to here for stuff, for speech, and I go to a lot of what you were talking about, aphasia. Yeah, and it's helped me a lot, and I think that Dignity and all these people, they're my stroke recovery team, and it's been nice, and I love all these kids, and it's all good.
Others in the very college school. And my son's son, when I was 6 years old. And I'm the parent on the left side of my life, couldn't raise on my head. And then I walk all over it, and lose things on my head. And the mother fell 7, and then I walk over here, and roll all over it. Sister had a second stroke. My second stroke took away my father. And broke through heart. So I used to say I hit my right in twice. But there's two people help me for once and wonderful people. I knew I heard a congregation. I heard saying,
Hello. This is easier than I had imagined. I'm Teresa McCormick. Let's see, I had a stroke in 2022? Last year, 2022. I went to an acute care hospital for a week. I was also at Dignity for just a short time. Then I went to advanced neurological therapy because I still had balance issues. So that's my biggest challenge is balance issues. And I didn't find this group until a year later when I again was going through paperwork and saw that there was a chimes class. And so I called them and I said, can I still come and join you because it's been a year ago? And they said, yes, you can come as long as you want. And so here I am. It's been a great help. And I think we've all improved just by sharing our story, and of course the music helps. Sometimes we don't do them together, but it's beginning to fall into place. So it's nice being here. Thank you.
So this group actually inspired me a lot in college with music and speech. I didn't know much about strokes and aphasia until I met them. And there's a lot of individuals who have aphasia, specifically an aphasia called Broca's aphasia, if you know what that is, where they have a phenomenon that they have difficulty like expressing with just speaking, but with singing it's easier, more fluent. So I worked really hard in college to take speech classes, understand what's happening, and I'll be attending grad school in the fall for speech pathology in hopes to do more research on speech and music's effect on speech. So this is such a fun group to work with for me, and they've inspired me so much throughout my whole career. Woo. We also need to recognize the wonderful caregivers that show up every Thursday with us. They bring their husbands every week, and they also have their own support group. Dignity Health has done a lot for individuals with strokes and also caregivers who had strokes, because caregivers also go through this journey. So thank you for watching, and we are going to have Yuli come up and talk about stroke prevention and awareness afterwards. If you guys have any questions for Yuli, caregivers, stroke survivors, or me, you can throw them at us.
Thank you, guys. We have some snacks. They are healthy. The healthiest is the water, so yourself hydrated. But we're gonna take this opportunity, and I know you probably are familiar with what a stroke is, but part of what we do is not just to provide support for our stroke survivors. Some of these patients and some of the members of our stroke support group are not patients that we have taken care of, but this group is open for everybody who had a stroke or any family member who needs support. So if you guys know any stroke survivors anywhere within the valley, you can always refer them. There are some few groups here in Arizona. There's a aphasia group down in Phoenix, everywhere. But this is also for free, something that we do to be part of our patients' recovery. And I would like to thank Amy personally to continue the legacy that Amy, our previous music therapist, had started with the Chimes Choir. It's, like I said, it's such an amazing opportunity for us to show them that there's a life after stroke. And if you can see their t-shirt, it has hope, joy, and new normal. So that's what, those three words are their favorite words that they live with. And that also inspired me to show to our patients to give them hope when we take care of them in the hospital. So my name is Julie Smith. I'm a nurse practitioner by profession, and I manage the stroke programs for our East Valley Dignity Health, Chandler Regional, and Mercy Gilbert. Jana here is one of my colleagues, nurse practitioner, also work with me in the acute care setting, and Yasmin is one of our neuro or stroke nurses in the hospital. So before I get started quickly, we're gonna go ahead and pass this magnets. I want you guys to take one with you, or if you don't like the magnets, someday you will remember me, you will save someone's life by recognizing what a stroke is. And you guys can just pass it along. And this will be a really quick presentation. And this is, like I said, this is designated for our stroke survivors and our Chimes choirs, but I asked Emmy, hey, can we take this opportunity to do a quick stroke awareness? May is Stroke Awareness Month, so we're gonna quickly talk about what a stroke is and what the signs and symptoms of stroke. So if any one of you can tell me what you understand about stroke, feel free to let me know. You guys know what a stroke is? We'll make it easier for you. Yes. lack of oxygen to your brain because of lack of blood flow. Exactly. So it's like having a brain attack. When someone is having this elephant sitting on their chest, one of the arteries supplying their heart is clogged and they're having a heart attack. Okay, so, but when one is having a stroke symptom, which you have it on those magnets, that flow to their brain or the blood vessel supplying their brain is also clogged. So thereby, there's no blood flow to the brain and can lead to what we call stroke, which is really the damage caused by lack of blood flow to the brain. Okay, so when we talk about stroke, there are two types of stroke. There's what we call the bleeding type of stroke and the blockage type of stroke. So when there's a bleeding, that's about 15% of the patients that we see in the emergency room have the bleeding types of stroke. Blood vessel ruptures or tissue, including the tissue parenchyma, there's blood that just spills all over. And because of that blood spilling everywhere, it's causing damage to the area of the brain. And when we talk about ischemic stroke or the dry type of stroke, that's because of the blockage of blood flow because of blood clot, or maybe a narrow artery, or maybe a piece of plaque that breaks free from a big artery, clogging those small ones inside the brain. So that's easier, right? There's a wet type of stroke and the dry type of stroke. And we do have different management when we see them in the emergency department. But one of the most important things for us is not really on treating these patients coming to the emergency department. We have protocols and processes in place on how we can expedite treatment to minimize that damage in the brain. But we're here because we would like to communicate with our community the most important part, which is number one, prevention, and number two is to recognize the stroke symptom. All right, so look at those magnets that you guys have and we'll go over it. There's the little fly in front of me. Okay, so if you remember this word is called BFAST. You've probably seen it in social media, articles, or everywhere. Just remember the word BFAST. So when you recognize stroke symptoms, BFAST. B starts with balance. Okay, so when someone is having sudden onset of dizziness, they're losing their balance. Do you guys drink on the weekends? It's kind of like having a little adult beverage, but you did not really have adult beverage. So sometimes they complain about losing their balance. They're maybe leaning to one side, they're falling. That's a sign of stroke. They think like, oh my gosh, you know, I'm busy, I can't feel my balance. They just stay down there and wait. Damage is happening in the brain, especially if these are sudden onsets. That's an emergency. The second one is what? Eyes. So what happens with the eyes? Loss of vision. It can be your peripheral vision, or you just can't see. We've seen patients coming to the hospital after 2 weeks of having a vision loss because the first thing they're gonna do is what? They schedule an appointment to their eye doctor, exactly. But they didn't know that they're having a stroke. And you probably know there are different parts of the brain that controls different functions of the body. And whichever part of the brain is affected, you will have that symptom. So what's our next symptom? Face. So droopy face. That's very straightforward, right? And it's very easy to recognize. Someone smiles, part of their face is droopy. Next one. What happens to the arm? Jimmy here mentioned one side of the body is weak, the arm, the leg, or both. And it's not just weakness, it can also be loss of sensation, or things that I just can't feel my arm, you know, or my arm is just moving everywhere. We've seen patients complaining, I woke up in the morning, I'm trying to drink my coffee and it's just spilling all over, or I'm trying to write my papers, I just can't even scribble any letter. That's a sign of stroke. Some patients will think, oh my arm just fell asleep, that's probably gonna go away later. They won't call 911, they won't come to the hospital until they can't move their leg or arm at all. So we've seen those. That's why it's very important for us to advocate for recognizing the stroke symptoms and getting to the hospital. And what's the last one? Well, not last one. Yes, speech. There you go. We talk about aphasia, which is difficulty getting those words out. Sometimes we find ourselves having this little, hiccups that, what is that thing? But usually when you're having a stroke, it's not just that little thing that you will remember. It's for them, they just can't even get that word out. And some patients will try to talk, but words are not coming out correctly. This is also other important thing about a patient. It's not just about expressing, but it's also reception. So you're trying to tell them something, they're not understanding at all. Or you ask them something, word salads just coming out, not making sense, out of the blue, nonsense words. Those are emergencies, okay? And what's T on the BFAST? What do we do for time? Time to go home right now. Time to call 911. Why do you guys think that it's important to call 911? So we can get help. Do you know that every minute, when that brain tissue or part of the brain is not getting blood supply, there's about 1 million, almost 2 million brain cells that start to die. So what we need to do is time to call 911 to get to the hospital as soon as possible. So not just because trying to get to the hospital, but there's this medication, it's called clot busting medication that we give in the emergency setting. It works to find where the clot is and dissolve that clot, okay? Unfortunately, this medication can only work within 3 hours when that symptom started. That's why it's very important, and D is on that B fast because it's time to call 911. Not all patients may be eligible for this medication, but it's something that has been studied. It has proven outcomes for our patient that it can potentially reverse or minimize the stroke disability that they have. Unfortunately, some patients wait too long to come to the hospital, and we won't be able to offer that treatment anymore. There are some more treatments that we can do. It's to go up to the brain and pull the clot out directly. That's a little bit more advanced. And of course, if there's a bleeding in the brain, we want to stop the bleed, scan the patient. Okay? The other important thing about calling 911 is our EMS providers are aware who the primary stroke center are or who are among our hospitals in the valley have the capability of treating stroke patients. You check in a hospital, they may not have that training to give that medication, but some hospitals, Banner, Dignity Health, St. Joe's, Abrazo, everywhere, there's designated hospitals, we call them primary stroke center or comprehensive stroke centers that can treat the stroke patients. And we do have protocols in place to expedite the treatment because it's required for us to treat stroke patients and deliver that clot busting medication within 30 minutes of patient survival. If you have EMS, we work with them closely. They call our hospital, our stroke team is activated, we wait for them in the ER. So that's an extra VIP treatment for our stroke patients coming in. Because again, we only got one brain. We don't want that brain to die. And if there's a chance for us to do something to minimize the damage and save that area of the brain that's about to die, we will do everything as fast as we can to save that brain. The liver can recover. Part of the liver dies, it's gonna regrow. The brain is not, the heart is not. So that's how important it is. When we talk about stroke prevention, I just want to touch base on that topic real quick. If you have family members, you guys are all young, family members who have a history of high blood pressure, high cholesterol, diabetes, I hope none of you guys here are smoking. Okay. Sleep apnea, when you stop breathing at night, you're also lacking oxygen to your brain. Any of those family history increases your chances of having stroke as well. So educate your patient and family, exercise. Do you know that there's this American Heart, American Stroke just released the Essential 8? You guys, are you very familiar with Essential 8? If I can remember now. I think exercise, nutritious food, take your medication, control hypertension, sleep. You know that sleep was just added, number 8. It's one of the essential 8. Sleep at least 7 to 8 hours a day. Sleep is also a very important part of that. What else? Well, I'll let you know if I remember, but there's 8 essentials. Yeah, look him up. You can on your phone. There's 8 essentials. Take your medications, exercise, nutrition, avoid smoking, control your weight, walk every day, sleep, and no alcohol. All right. Are there any questions you guys have for me?
Can you see a stroke in the brain before it happens? Does it store itself, or is it only while it's happening you can see if you had a stroke?
So a patient will start having a symptom once there's something going on in the brain. That's how you will know it. So there's what we call transient ischemic attack. So it's called mini stroke or TIA. Have you guys heard about that? That's when the patient start having all the symptoms that we just talked about, but then it's resolved quickly. That's a warning sign of stroke. And about 30% of this patient who are having that warning sign of stroke will have a full-blown stroke in the next 90 days. So if someone's having that symptom, oh, I just can't feel my arm, it lasted for 5 minutes, I can't even lift it up. That's a medical emergency because you're having a warning sign of stroke. And if that's not resolved or evaluated, that can potentially be permanent later on. Yeah, you will start having all this body function loss once there's a problem going on in the brain, whether it's decreased blood flow or there's already a tissue death. But most of the time, you will start having all the symptoms first when there's a decreased flow. And when it lasts longer, that area that's not getting blood supply, it will die. And we can't do anything about it once the tissue is dead.
So can you see, like, after someone has a stroke, if they have like several more strokes stored in their brain? Is that something that is visible?
So when we do MRI, so you guys familiar with what MRI is? Advanced imaging that really gives us a picture of the brain. We can see new stroke, old stroke that happen. And sometimes as we grow older, think about our blood flow is like a 5-way lane traffic. Eventually, right now you guys probably have 5-way lane traffic of blood flow to your brain. When you grow older, like that, love you guys. When we grow older, that 5-way lane traffic gets smaller and smaller. Probably it's gonna go into 1-lane traffic. And think about those smaller blood vessels that's slowly getting clogged and clogged. And we may not even feel it, but the area that it's supplying will start to die. So that's what they call silent stroke. Sometimes we may not even have any stroke symptom because it's only a very small tissue of the brain that's dying. But it's like a snowball. As we grow older, collectively, that tissue will become bigger and bigger. And we can see it on the imaging later on when we do MRI. Oh, by the way, the other risk factor for stroke for a young population that we've seen is contraceptive use plus smoking. Okay, think about that. And then the other one is chiropractic manipulation. I've seen a 26 years old patient who was having some back issues, went ahead and did some chiropractic manipulation. So part of the blood vessel in the back of the head, what we call dissected, and that caused her to have a stroke, lost her vision. So what I'm saying is, I'm not saying you can't do chiropractic neck manipulation. Just be very cautious when you do any of those, because it's also one of the things that we've seen, especially when they start manipulating the neck. Okay.
Babies to older anytime.
Exactly.
Just to remember that stroke happens to anybody, anytime, any age. Babies, when they're born, stroke happens any point. We have members of the Dignity group that were in their 20s when they had their stroke. So just remember to take care of yourself.
Exactly. So we talk about those risk factors that we can do. I mentioned about high blood pressure, high cholesterol, diabetes, but there are some things on our genetic, what we call non-modifiable risk factors. There's nothing we can do. when our blood vessels, first of all, is already really thin when we were born, or there's some anatomy going on. Sometimes those are hard to do anything, even if we live the healthiest lifestyle. But we know 85% of stroke is preventable. We just have to focus on those risk factors that we have. Okay, any other question?
Are you more apt to have a stroke, more strokes after a first one?
So one of the risk factors for stroke, not modifiable, is a patient having a history of stroke will have a higher chance of having more stroke. That's why when a patient has a stroke, we just don't send them home and give them medication. We look at every single risk factor, whether it's the heart problem, whether they have diabetes, high cholesterol, or whether it's any clotting disorders that's causing them to have the stroke. Because the next goal after stroke, aside from rehabilitation, is to minimize the risk of having another one. Any other questions?
Yes, ma'am. If I'm with someone and I start seeing these symptoms, besides, also in addition to calling on normal, is there anything like physically I should be like making sure that, you know?
I love that question. So this is what the EMS providers can ask them. We always teach them. When was the last time you saw that person normal? So the first thing you want to know is what time is it? That's why there's feedback there, time to call 911, time to check your time. Because, you know why? Remember I told you guys a while ago, we depend on the 3-hour window. So when they give us an accurate time that, hey, this patient or this person was last seen normal at 2, the patient got to our hospital at 2:30, that's perfect. We're within the 30-minute window, less than 3 hours, we can give that medication. And then the next thing is, don't give them aspirin. Never give aspirin. It's not a heart attack. Remember I said it's a brain attack, but remember there's 2 types of stroke, the bleeding and the blockage of blood flow. We've seen families giving aspirin to patient family members who are having stroke symptoms. The other complications for stroke is swallowing difficulty. About 70% of our stroke patients have facial droop and swallowing difficulty. So a speech therapist, that's one of the things that they also evaluate. Any silent aspiration, there's other different modes to do that, like MBS, very swallow or feast, but that's also affected. So we also do not recommend giving them water, pills of any kind. You can lay them flat, that's a good thing, or maybe a little 30 degrees, because some patients, they might aspirate even just with their saliva. Really, those are the only things we can do and then get to the hospital. And if you know somebody like that, and maybe if they have history, we know about histories, medications they're taking, because again, like I said, not all patients can receive that clot-busting medication if they are on strong blood thinning medications, or we still need to know the complete picture of that patient, because there's also a side effect associated with that medication that we give, which is bleeding. Any other questions?
I had another question about, I guess I have a lot of questions because one of my mentors had a stroke recently. So after you have a stroke, not part of the brain gets damaged, is it continuous? Because I just feel like I've noticed that through his recovery, he seems like he's a lot more confused than he was maybe 2 weeks ago.
So there's definitely a recovery after stroke. That's why you see all this wonderful stroke survivors here. And when I met Jim, one of the stroke survivors, I can't barely communicate with him. Now I can communicate with him, and it progresses over time. I was listening to this podcast about the brain, that the brain, if there's a damaged area, the other part of the brain will optimize whatever that function is. They're going to try to take over. It's the same scope with neuroplasticity. A part of the brain will try to take over, and that's how patient recovers. But when you talk about Is there a chance for them to get worse after a stroke? Yes, definitely. There's a tissue damage in the brain, and sometimes that tissue damage in the brain is very unstable. It's just, eventually it's just gonna form a scar. But some patients with existing medical conditions like diabetes, if their blood sugar is really high, that can trigger this damaged area. They will look like they're having more stroke or having more symptoms. Dehydration, infection, lack of sleep, any of those things can trigger those dead tissues, so it looks like they're getting worse. Or sometimes too, if there's a prolonged decrease of blood flow, if they know that they have a narrow artery and their blood pressure is too low or too high, that can still exacerbate symptoms that they're having.
I think I had my timeline a little bit messed up because he had a major stroke about 8 to 10 years ago, and then recently had another one. That this was considered more of a mini stroke, I guess. It's confusion because I saw him before and after. So before his stroke, in our music lessons, he seemed like a lot more forgetful, and I don't know if that was maybe a symptom, if he was starting to kind of have more difficulties before he had that second stroke.
So it goes with which part of the brain is affected. So there, we also have our memory center of the brain. Sometimes we see patients with temporal lobe stroke. They will have short-term memory issues, difficulty of storing these new memories. And some patients also, I mean, it's case-to-case basis, that I'm not assuming this is probably this case. If they have large amount of damaged tissue in their brain, that can also be a focus for seizures. Some patients will have what we call focal seizures. This those on and off electrical activity happening in the brain can cause this temporary confusion or difficulty, or well, even if absence seizures or any kind of seizures can happen when the patient has a significant history of brain injury, which is caused by stroke.
Okay. I just didn't know if there's any other symptoms from like ALS that maybe I could like text his wife about, and maybe things a little bit not normal today.
Yeah, it can be like a progressive, you know, sometimes they're also at risk with what we call dementia, which is a progressive memory loss, short-term memories. And if you have this significant amount of damaged tissue in your brain, eventually you're gonna start having these balance issues, incontinence, and memory loss as well. Yes, you know, as we grow older, we will accumulate all this dead tissue on top of the stroke that we already have. So we'll have all these constellations of symptoms associated with volume loss in the brain. Yeah. Other things that I did not mention for the BFAST is subtle symptom. Sudden onset of severe headache is a very, very common symptom for the bleeding type of stroke or the hemorrhagic type of stroke. Both the bleeding and blockage type of stroke will have almost the same symptoms, but the bleeding usually will have this pain associated with it, sudden onset. Any other questions? Thank you. Thank you for your question.
Thank you.
One more hand for the Rivers of Hope as well. Okay, just recover and find a new normal. Once again, super inspiring group, and I love working with them. I look forward to every Thursday when I get to see them. Caregivers, do you have anything you want to add? Yeah. Okay.
Partial videos. Yeah, if that was then. Matter of. Any symptoms. He got back in bed, he was fine, all his arms and legs were working fine, got in bed, went to sleep. So he woke up. And then his arms being mangled underneath it. You know, so there was no sign of anything. Someone have water in touch with someone, that's what any loss of body function that is sudden. Don't remember that he has any sudden onset of loss of body function. It's not normal. When you call it
complain about a headache. But there were fairly often people come home from work or who says, I'm feeling a headache coming on, I'm laying down. So when that happens more regularly, you really don't think that much about it. And then we were actually here on vacation when it happened. And so he decided to go in the shade and he would stand up and then he would sink down and couldn't move anymore. So then when my daughter said something was not right, to call 911. And the reason he actually survived was we were 2 blocks away from the helicopter because he had a massive bleed and he had emergency surgery right away. And he was 2 weeks in ICU and then.
Love modern technology, but.
Okay, today.
It's all part of the course. You'll learn a little bit today, guys. I know some practicum students, their class is technically over, so if you have to go ahead. It's not rude. I understand. Also though, if you want to stay and ask any questions, feel free. I know we didn't talk too much about music therapy and aphasia and music therapy and stroke, so if you have any questions about that, specifically a neurologic music therapist, we do a cool special technique. I haven't got to do with them yet because we've met in groups, but maybe sooner or later we'll break off and I'll get to see them one-on-one. But if you guys ever heard of melodic intonation therapy, that's created by a speech pathologist, but music therapists use it very often, especially trained neurologic music therapists. But yeah, does anyone have any more questions for stroke survivors, caregivers, or me as a music therapist? Does anyone have any questions about like music therapy in general?
I know that they can be helped with across several things. Is this the only music therapy program or is that?
I think it's just us. We are very fortunate that we have our East Valley Foundation continuing to support our stroke, support group, our music therapists and all that stuff. But I don't, it's one of the, I think we're just the only one here with the health system so far. We're very proud of that.
I will say that Chandler is the only one that has a music therapist in the valley for Dignity Health. But California's Dignity Health System, they have music therapists. In Florida.
I think maybe I missed it because I was sitting at the same number but in a different building. Yeah. But what is an intervention that you use for your stroke patients that you feel like is your go-to?
I mean, a lot of our stuff is running through these songs, but it's not just running through songs. Everything you do has a purpose, and you just find the purpose within that. So a lot of it is executive functioning, right? A lot of cognitive goals, a lot of motor goals. There's sometimes before sessions, we'll warm up with bilateral movements, kind of start engaging both sides of the body. Now, we know from a stroke that it affects one side of the body. It's more difficult for some or others when we're crossing midline. That's a very difficult motion, especially with someone that's had a stroke or aphasia or a TBI or autism. Across the board.
Like piano, if they're able to go.
So fine motor movements are very difficult for some. Again, it's every stroke is different, every recovery process is different. It's you kind of have to look at the patient specifically. So yes, if they're able to use fine motor movements, go ahead and use them. But I also find why are we doing something specifically? So we sing and we use music to help with speech, right? So we sing in order to help with speech. Singing is one of the things that may come easier to others than speaking if they have aphasia, depending on which aphasia they have. There's a bunch of different types, and you should look them up and you should know them if you're music therapy users. But yeah, so singing helps with Broca's aphasia, helps with fluency. Because of neuroplasticity, we are able to use singing and slowly transition that into speaking using melodic intonation therapy. That's one of the interventions. But that's specifically a neurologic music therapy intervention. So I would make sure you get trained in that before you do it.
So I got melodic here.
Oh, awesome, okay.
Yeah.
At ASU?
Yeah.
Oh, you did the research thing, right?
Yeah.
Awesome. Yeah, Arizona State University does a lot of research. I was a research assistant when I was here for music therapy. It's a lot of good experience, but yeah, everything you do, there's a specific function for that. So we don't necessarily define motor movements because our specific goals are to improve quality of life, to help with speech fluency, to kind of expand social circles, support, you know, a biggest part of this group is support, and learning how to find a new normal. And I think that everyone helps guide each other through that. Especially caregivers understand finding their new normal, for sure.
Still looking.
Yeah, we're still looking, but we'll find it one day. We'll find it one day.
Is there a specific song that you feel like most stations really like to sing or play?
Happy Trails? Well, our group, Happy Trails, yeah. So that's one thing, is that there's no specific song. It's more about the complexity of the song. So if it's a really complex song, it's probably not a great song. It's also, I have a problem with this. Sometimes I go too fast. It's important to slow yourself down, especially when someone's had a stroke. Because it's easier for them to comprehend what you're saying when you speak slower, when you kind of run through the interventions a little bit slower. And then you can always speed it up from there. So you can start slow and speed up depending on where you need, but it's hard to speed up and then slow down because that can increase frustration with the client. But yeah, so no specific song. It's really per person. It's kind of like when you're a music therapy major and someone says, well, what song should I be listening to, right? So it's that always frustrating question that you get. But yeah, any other questions?
Is this kind of something that you wanted to do when you were a student, or did you go into it?
I grew into it. Well, actually, yes and no. So I became a music therapist because of the Gabby Giffords case, if you guys know who that is. She was a politician who was shot, and she regained speech through music therapy. I mean, obviously a lot of other therapies too, but she credits music therapy to really helping her. So that's what I looked into. I was going to become a therapist of some kind. So I was just trying to figure it out in high school, and I was like, that's cool. So I went into that, and then I figured out I can go for music therapy, do some classes while I'm an undergrad, or you don't have to do classes while you're an undergrad. There's some programs that don't make you do that. And then go into grad school for speech, because I was really interested in how music affects speech. I mean, you see the cool cases on American Idol or America's Got Talent where they have a stutter and they can sing just fine, or they have a stroke and they can't speak, but they can sing just fine. So I want to do more research on that because we know it helps. We don't know all the facts why it helps, because music is processed in different parts of the brain. It's a different part of the brain, and music is all different parts of the brain, left and right. So I look forward to researching that more. Does anyone have any questions about like music therapy and speech, or going into a different or specifying how to use music therapy treatment? All good? Okay, well, let's give a round of applause for doing it. Come up to me and ask, or if you want to exchange emails, I can give you my email if you have any questions for later.
Awesome. Can we give them one last round of applause? We just want to thank you guys, the ASU Music Therapy community, and from our student organization for coming out and spending your morning with us. So thank you so much. Thank you for the presentation on stroke awareness and prevention. Hope everyone makes sure those magnets are visible in your homes, in your apartments, in your dorms. Share the picture of the card with your loved ones. Every moment you act is a moment that that person is benefited from that. So make sure that is spread out and shared with your friends today. As always, we like to give a little incentive item for everyone who comes to our meetings. This year, today is a big one. We are raffling off 2 cajones to our students who are here today. So every student should have gotten a purple ticket. Disclaimer, like last week, if you were at our meeting last week, Amazon's having some issues delivering things. So those are getting actually delivered to Maggie's house later this afternoon.
So if you win, just come to me afterwards and like, I have a
Friday or come up with a time this week to do it?
Yes.
They'll be here today. They're not here presently. So if you went and talked to Maggie, you can try to coordinate something to pick up from her house some point this week. Or we can just wait until next Friday at our last meeting to get this to you. So can we get a drum roll, please, for our first home winner? Number 060186. All right, drum roll for our second winner. All right, 060187. Ah, right. Can both of you speak with Maggie to try to coordinate what time you want to pick up that cajon, whether you want to do it next Friday or sometime this week. If you have any questions for any of the people who came today, please make sure you go up to them and have a chat. There's snacks to enjoy. Take any extra cards to pass out to people on campus today. A cajon is like, you can sit on it, it's a box, and it's a drumming instrument. Yeah. So they're really helpful for music therapists who are traveling around, because it's not like taking huge drums with you everywhere, so you can just take a box and sit on it. There you go. All right, thank you so much, everyone, for coming out today. One last thing, really quick. Any student here who has an instrument that they're thinking of getting rid of or just have too many of, London is taking donations for St. Luke's to donate those to the floor so that patients can use them in their recovery. If you have any extra instruments that you're looking to get rid of, talk to London and we can coordinate time to donate these. Thank you.
Yeah.